So doctor, like you said, that not enough is being said about or talked about this subject. However, I noticed that in the last few years, some big corporates or big pharma companies are actually talking about women-centric issues. So what is your take on that?
Pooja, I would say that yes, pharma companies may be talking about it, but we live in at least in urban corporate world, it is all about the bottom line. It is about the economic agenda. So I'll give you a few examples. First of all, first one was there was this model or actress. It was declared that she has died because of cervical cancer. The next day, she came up saying that it was fake, and this was just to promote the awareness about cervical cancer vaccine.
Yeah.
Now, this was an ad campaign run by the vaccine manufacturers, the pharma companies. I agree, it's very important to talk about cervical cancer. In India, cervical cancer is the second most common cancer after breast cancer. It's the second most common cause of cancer-related deaths in women.
Okay.
But do you know that in the Western world, long before the vaccines were here, they had decreased the incidence of cervical cancer to a great extent only by something called cervical cancer screening. They screen for the pre-cancer stages and treat it before it develops into cancer. There is no talk about the screening.
Yeah.
They talked about vaccine, they talked about cervical cancer. Yes, it's important. But did they say that no, the screening is must? Every woman for 3 years after she's been sexually active or after 30 years, every sexually active woman has to go for screening. From 30 to 65 years, they should go for screening. And this is what will, we can screen and treat and prevent cancer from happening. In fact, did they say that vaccine is most effective for women who are not sexually active yet? It is most effective in young girls. And after 25, yes, they can take it, but it is not as effective. Once you are already infected with HPV, once you are sexually active, there is a strong possibility that you are already infected with HPV. So, your chances of getting the infection or prevent this vaccine preventing the infection go way down.
Yeah.
It's only 50 to 60%.
Yeah.